Hi again, everybody. Linda Pellegrino singing along to the music with you here on Senior Radio Buffalo. So great to have you with us, and so great to have my guest standing by here to tell you about more of what Absolute Care of Aurora Park can help you with. Now, you know, they have subacute care, they've got long-term care, and they've got dementia care. And it depends on what you need that these folks can help you with. To explain, case in point, especially about their subacute care and what that is, we've got Stacy Bastian standing by. She's the administrator, and Lorrie Mueller is the director of therapy at Absolute Care of Aurora Park. So good morning, ladies. Nice to have you here.
Good morning.
Good morning.
Now, we understand what long-term care is. I understand what dementia care is, but subacute care, maybe we can explain what that term means.
Sub-acute care is the bridge from hospital to home. Many of our patients come here to get rehab services, nursing services, social work, and try to maximize their functional potential and make sure that they are safe before returning home.
So it can be a therapy type of care.
Correct. Or nursing care as well.
Okay, and you can treat injuries, and I understand fractures and cardiac, pulmonary, stroke, neuromuscular. It's really quite it's quite wide what you can help people with.
Correct, and even the age ranges as well, from early 20s to in their hundreds.
Wow, that's amazing. You also have specialty services, such as dealing with folks with lymphedema and bariatric and dialysis care. Maybe we can talk a little bit about that.
Absolutely. We newly opened our dialysis clinic here at the facility where we have dialysis services provided to residents that need that 5 days a week. It's a gentler form of dialysis as opposed to the normal model where individuals usually go for a longer time frame for 3 days a week. Individuals that go through that model report, feeling fatigued and tired, which doesn't benefit them, especially if they're in a rehab stay at our facility. The dialysis that we offer here is through Dialyze Direct, and it is gentler, a shorter sitting time on a daily basis. It keeps the individuals healthy, and they have more energy to participate in therapy and then ultimately go back home to the community.
That's great. Now, we're speaking with Lorrie Mueller and Stacy Bastian, who are working with Absolute Care of Aurora Park, and they have so many services that are available for you. As a matter of fact, they have a recently modeled state-of-the-art therapy gym, and even with COVID, it's been remarkable how you can get people in there, work at a distance, and take care of all the social issues, that we have with keeping people safe, and you can help people recover.
Absolutely. Our new gym includes a kitchen, a bathroom, an ADL suite, so they can practice real-life home skills that they're going to need at home right in the clinic before they are home.
That's fantastic. Maybe you can describe a typical day for a rehab patient.
Absolutely. So the rehab patient will be assessed by the staffing, the registered nurse, and the professional medical staff. We have the support of Dr. Shields and the medical group here on site 6 days a week, working directly with the clientele that's on the unit. After their breakfast, they go to therapy, work with the physical therapist as well as occupational therapists, building strength so that they can get back to their baseline and return home to the community safely.
That's great. Stacy and Lorrie, when people come in for therapy, they really have a rapport with their therapist because they're coming in often and they're sharing, how they're feeling. So you must really have a wonderful staff that has that compassion gene, so that not only the conversation but the relationship really does benefit the patient in so many ways.
Absolutely. And, I have to say that Lorrie sets that culture here at our facility with her department. She brings a wealth of experience, 21 plus years as an occupational therapist, as well as 18 years in a leadership role running therapy departments. So she has set the culture of, providing care to these individuals as if they're family. It's a simple expectation, but it goes a long way.
Oh, yeah. And at Absolute Care of Aurora Park, I also understand that your therapy department works with other departments in the facility to create that real interdisciplinary approach so everybody knows what everybody else is doing for the patient.
Absolutely. I'm also a registered nurse as well, and it's so important to get a holistic picture of the patient, making sure that we're addressing their medical needs, their physical needs, their mental health needs, as well as their social needs, because you have to look at everybody as an individual. And not every person is going to have the same needs, and we have to look at that and ensure that we're addressing them and being proactive in our approach.
Oh, yeah, and it's so important because right now, with COVID and everybody being so careful, we want you to understand that Absolute Care of Aurora Park, their therapy department is continuing on their subacute care because it doesn't, working with folks and getting back to your 100% doesn't wait until COVID is over. So these folks are still there. They can work with you safely, and they can manage anything that you might have had an injury for. Injuries, fractures, cardiac, pulmonary, stroke, neuromuscular, lymphedema, bariatric, dialysis care. And, it's important to know that care continues. And Lorrie, I love it because you're the director of therapy at Absolute Care of Aurora Park. And I know you really have a personal relationship with some of these incredible patients who become family. And I understand you even went so far as made a spaghetti dinner for a patient. Tell us about that.
Yes, I did. It was, he was an Italian gentleman, and I am married to an Italian. So I was telling him about some sauce and meatballs I had made, and he asked me to bring that in for him, and I did. I was quite nervous on what he was going to say, but he actually liked it, and I passed that test. But it was great to be able to really develop that relationship with him and his wife.
Wow, that's great. Listen, Absolute Care of Aurora Park does a great job, but I know there are other Absolute Care facilities that offer subacute rehab. Maybe we can talk about some of those.
Absolutely. So our facility offers services for dementia care. There are certain individuals with a diagnosis of dementia or Alzheimer's that have the tendencies to wander. We offered a unit that is secured where we provide activities geared towards engaging them in meaningful purpose as well as, providing quality to them. We offer long-term care services here for individuals that need a higher level of care and assistance for living, making this their home, as well as the rehab services here in our facility.
That's great. And the other areas, just in case you're not in the East Aurora area, they have a facility in Gasport in Niagara County, Westfield in Chautauqua County, Allegheny and Cattaraugus County, and Three Rivers towards central New York near the Corning area. So if you're listening to this broadcast this morning and you say, I like those people at Absolute Care, how does one become a patient in the rehab program, and do they need a referral from their doctor?
Typically, if somebody has a recent hospitalization, they could certainly discuss with their physician that's handling them in the hospital or their social worker and express a request that they would be interested in coming to one of our facilities for rehab services, as well as their primary physicians in the community. If, they have a need, they can certainly discuss that with them as well. Our facilities are under new management through RCA. They are committed to excellence and provide us with wonderful support so that we're assuring that we're providing excellent care and meeting the needs of all the clientele that we service.
That's great. And we're speaking with the folks from Absolute Care of Aurora Park. We're speaking with Stacy Bastian, who is a nurse and administrator, and Lorrie Mueller, who's the director of therapy at Absolute Care of Aurora Park. And we're talking about their subacute care and their services. And subacute usually means that it's somebody who's coming in for therapy. And right now, we may have had an awful lot of people who are staying away from this because of COVID, but it's really vital that you continue to get your therapy. And I know you want our listeners to understand that anything that you do over at Absolute Care is certainly going to be, you're going to be following the protocol, and you don't have a worry in the world when it comes to coming in and getting your therapy and hopefully getting people back home as fast as possible.
Absolutely.
Correct.
That's great. Now, for people to learn more, I suggest that maybe they go to the phone number, 716-652-1560. I'll give you that again. It's 652-1560. Or they can go to absolutecare.com and then look for the link to Aurora Park. And once again, we're talking about conditions a person might have in order to need something like subacute care. So, ladies, let's talk about that. Examples of the types of patients that are treated.
Well, we service a wide array of individuals with different diagnoses. Somebody who may have had a recent hospitalization and is just deconditioned, stroke patients, individuals needing IV antibiotic services, individuals that have had a recent fracture or surgical procedure, as well as individuals that, just need strengthening to meet their baseline so they could safely be in the community and not return to the hospital.
Yeah, and I love what you have. You have this brand new state-of-the-art therapy gym that actually replicates where people can practice activities of daily living in in-home settings like a bedroom, a kitchen, a bathroom, and they can go about and try to, replicate what it is they're going to have to do at home, and then you can show the therapist what you're having problems with, and then they can work on it directly. That is just great. I can understand why your rehab patients love coming, and they're getting better faster because of the care they're getting at Absolute Care of Aurora Park. I'm Linda Pellegrino. Once again, their number is 652-1560, absolutecare.com.